Like my experience of dealing with, I haven't dealt with a huge amount of, but psychiatrists in the public health system and therapists and one drugs worker, they kind of, it was as if kind of alcoholism like was a kind of private, alcohol problem was a kind of private matter, and they kind of left it up to you to go to AA and deal with that. You know what I mean? I just found that very it's a very lonely road. You know what I mean? So it'd be great if there was more, if there was more tests done, wouldn't there?
Yeah, I mean, you're quite right. I mean, and that would be the experience of a lot of people, because we don't have developed alcohol treatment services. And a lot of doctors themselves would feel they haven't been trained properly to actually deal with alcohol issues. And quite correctly, a lot of doctors feel, if I do an assessment, of somebody for alcohol abuse, where do I refer them? How do I help them? Because the backup services, they're just not there. And we don't put enough money into it, and we don't train the psychiatrists. And there is a real debate about it. A lot of psychiatrists would feel addiction isn't part of their brief, that they shouldn't be treating addiction. Obviously, we would come from the view that, look, you help the person in front of you, and if you can't provide the services, it is still your responsibility to refer and make sure that that person gets help somewhere else. And just referring somebody to AA, that's not good enough. AA has helped thousands of people, but if there's an underlying mental health issue, as a healthcare professional, you have a responsibility to make sure that person gets the type of help they need. And it shouldn't depend on where you live as to whether you get the right type of help.
Yeah, and I only heard recently actually that I think it's the biggest alcohol treatment centre in the country, Clonmara, Weir, is that what it's called?
Yeah.
Like it's run by some order of the Catholic Church, I think. Yeah. But you actually have to go to mass if you go there, don't you?
That's right. Yes. Now Clonmara Weir has helped thousands of people, and it's funded by the HSE. We have heard stories that people who go there have been told to get mass every day, and if they don't get mass every day, then they're not welcome to stay there. And I think part of this problem is that if you go to what's called an approved mental health service, which is a centre recognised under the Mental Health Act, that centre is inspected by the Mental Health Commission. Right. There is no independent inspection of residential treatment centres. In fact, the Controller and Auditor General did a report of community addiction services and said, we don't measure how effective these services are and what they're doing. We don't have an evidence base behind them. So we really don't know whether the services we're providing to people are actually helping people. We've no systematic way of saying, well, if you go into this centre, you have a 60% chance of being sober in a year's time. We don't have anything like that. And a few people have written books, for example, Valerie Farher mentioned in Come Back When You're Sober, that the same programme is offered to you each time you go in. It doesn't actually look at what you need and help you to deal with the issues in your life. For example, when I go in, I have an autoimmune disease. If I go back to my consultant and I say, I'm feeling bad, it's just not working, he doesn't say to me, well, Carol, you're not sticking with the programme. We go through what the issues are, and maybe it's I haven't been taking the medication correctly, but maybe it's the medication needs to be changed, or I need to do more physio, or I need to do more exercise. But we have that discussion. I'm not told, well, you have to go through this programme, and once you go through this programme, you'll be fine. It's a partnership, it's a discussion, and I think we need more of that in our addiction treatment services. Well, I think it's key maybe for people listening to realise that where they have an addiction, or where maybe a loved one has an addiction, that they recognise that when they go for treatment for that addiction, it's not going to address their underlying mental health issues, right? That they may need separate help for that, and they won't necessarily be referred for that mental health services. So one of the things we've done, and it's available on our website, just Google the A to Z of Irish Mental Health Services, and that will give you a complete guide to finding your way around our very, very complex mental health services and finding the type of help that will help you, because everybody is different.
Yeah, and I read there recently that the Minister for Mental Health, Kathleen Lynch, said that she's really determined that in the upcoming budget that the money for mental health services in the community will be allocated. But like even if it is, like the addiction services are still very far behind, aren't they?
Oh, very much so. I mean, I think it's down a lot to mental health reform, and I'm associated with mental health reform, so I'll just mention that. But they have done an awful lot of really good campaigning work with the Minister and with the HSE to try and get additional resources for the mental health services. But mental health services do not have responsibility for addiction services, and we don't have anybody in the addiction services who are totally focused on campaigning, like Solace. Jerry McAlison, I think it is, has done great work, and they've been in with the Doyle Committee, but they're providing a service. They are put to the pin of their collar because of cutbacks in funding. They don't have the time to campaign. So we've nobody in the addiction service doing the same thing. So one of the things we in Dual Diagnosis Ireland encourages for addiction services and people concerned about addiction services to support mental health reform, because a dual diagnosis issue is firmly on their agenda. So it also then brings mental health and addiction services working together, which is what we badly need.
And you're saying up in Letterkenny General Hospital, I think it is that the mental health services and addiction services are treated together, are they? Are they under mental health or what?
Yes, I was talking to one of the people up there, and they were saying that it's one of the few mental health services where addiction is formally part of the mental health service, so that when clients or patients present with an issue, they can be dealt with in an integrated fashion. And the Mental Health Commission did do a quick review of this area, and I found it very much depends where you live as to whether you get this integrated service or whether you're referred from Billy to Jack. And it's unfortunate for people. And one of the things I would say to people, that if you're admitted into an acute mental health unit, which is known as an approved unit for, say, a detoxification, and they're saying, well, you need to get help from an addiction service, we can't help you, we're going to discharge you, that you do have rights. And in the A to Z, we go through what those rights are, which is that they can't just discharge you. You have a right to a care plan, right? And that care plan is really important. It states what are the goals for you, and if you are being discharged, that there is a care plan in place. So it's very important that people know their rights, because very often services are so stretched, they're so overworked, that the care plan isn't put in place properly. So do not accept a discharge from a mental health hospital until you have a care plan that you are happy with. And I would say that to families as well.
And so would you be in favour of people with drug addictions and mental health problems being treated for both problems in the mental health services in the community and in inpatient as well?
I think what we need to look at is, what do people need? We need a range of services. It's not one size fits all, right? So if somebody is living in the community and they're participating in their activities and they're what the healthcare professionals call highly functioning, they don't need to go into an inpatient. They might need a detoxification. That should be done in the community. They shouldn't have to go into hospital to get a detox. But very few community-based detox services are available. So that's, an issue, even though in other countries these are routine, that you don't have to go into hospital to have a detoxification, unless you have quite complex physical health and mental health needs. So I think what we need to have is very clear clinical pathways, so that we treat people at the earliest opportunity, that they get the right type of service at the first time of asking. So if they go to see a GP, that the GP has time to talk to them, that the GP can refer them, say, to counselling if that's what's needed, can refer them into psychiatry if that's what's needed. If it's about them, they're drinking too much because they need a job, because they're unemployed, how do we help them get back into the workforce? So mental health isn't just about one type of service. It's about a range of services, and we really need to meet people where they're at, rather than saying, well, this is what we provide and this is what you take. Right? We need to be much broader in terms of our approach, because that's what works.
Yeah, I don't know a lot about other addictions. Maybe you can talk about them maybe as well if you want. apart from alcohol. But I think for a lot of people who had a drink problem or who are alcoholics, I think that this may not apply to a lot of them, but a lot of them are us, like, once you have the drink problem, even if you're months or years sober, you still have to deal with life one day at a time. So I think there should be some. I think people drink recovering alcoholics should be able to go for a quarterly appointment or something in mental health service just to talk about how they're getting on their addiction problem. Like, I remember the first AA meeting I went to years ago. I was talking to a fella before the meeting, and I wasn't sure if I had a drink problem, and I said to him, I'd love to be able to drink just once a week, and be able to control my drinking, And he said 100% of alcoholics would love to be able to drink once a week. The problem is we can't to control our drinking. That's why, and so, like, I personally rarely think about drink, but that's because I don't go into pubs really. Like, I heard one person say in an AA meeting, if you have a problem with overeating, you don't go into a sweet shop. I mean, I don't go into pubs, but it's something that, like, I think there should be kind of like people who maybe don't have a mental health problem, they had an addiction problem. I think there should be they should be connected with the system. Do you agree with that, Rick?
I would agree. I think part of the problem is we tend to make it very difficult for people to access mental health services. Like, you can be on a waiting list for months. Now, the current government has introduced counselling in primary care, and some areas have that, but already we're seeing long waiting lists actually build up. And I think this is where technology has a great role to play in terms of making it easier for people to access support. The trouble is that in Ireland anyhow, most of the online services are geared towards depression, anxiety, and they're very good, right? But there isn't a space for people who might have an alcohol problem to actually come together online and discuss those issues. Now, for women, and I believe men join it as well, there's Soberistas in England, which is a really good discussion board, and people can talk about their issues privately. So that's one way for people to access help, because again, it is so costly to provide services, and because of the lack of priority assigned to addiction services, it's unlikely the government are going to do anything much more about it. So I think people need to be proactive about seeking out help, and this idea of being able to just touch base occasionally, I think that's a great idea.
Yeah. And just to leave talking about alcohol, unless you have more to say about it, I'd recommend, there's a book my auntie bought me several years ago by Declan Lynch, the columnist with the Sunday Times. I think it's called The Rooms. I didn't read most of it now because some of the language is a bit it's a bit whatever, but like, it does. He had a drink problem as well, and the way he writes in the book, it's a fiction. I think it's a fiction book. Yeah, the way he writes in the book will really give you an understanding of, I think, like, how alcohol is to a lot of alcoholics and recovered alcoholics. You know what I mean? Have you ever heard of that book?
I've heard of it, but unfortunately I haven't read it yet. It sounds quite interesting, so I would like to read it. But I do think we need to be very clear that for a lot of people, if we address their mental health issues, the problems with alcohol become a lot less. It's not going to solve the problems for everybody, but I think it is clear that people should never give up hope that they can recover from their alcohol, because they can, with the right supports and the right treatment.